We're in that season now where the flu virus is at its highest. And so programs like this gives me the opportunity to interview people to tell those in the community how to take care of themselves. Let's go meet one of them now. Welcome to our community engagement program. Programs like this are designed to bring relevant information into your home. And we're in that time of year now where it's getting cold and people are catching colds and need to be supported. Well, in the studio today we have Christiana Panna, who's a nurse in the NHS, and she administrates the vaccine. And so we're going to speak to her, and I'm sure she's going to tell us exactly what we need to do in these very cold winter months. Welcome.
Thank you.
It's so good to have you with us. I love these programs because these programs really help us and direct us, and it gets the message out there. Christiana, you actually help to administrate the vaccine. Tell us, where are we in this? What's happening, and how do you help to bring the vaccine to individuals, vulnerable people in this time of the year?
Well, I work with the South West London Vaccination Programme, and we tend to go out into the communities and offer the services of having vaccination to protect you through these winter months.
Yeah.
For, against flu as well as COVID.
And it's quite serious, isn't it, out there? Would you say it's vitally important that we get vaccinated?
It is, because already in the hospital we're seeing the numbers rising regarding flu as well as COVID. And so for those who are vulnerable, and we're thinking of those who are 65 plus, or those who have any kind of immunosuppressant conditions, or sort of genetic disorder that makes their body vulnerable against fighting this kind of viruses, we are aiming to try and vaccinate them to protect them.
Would you say I know we're going to come into the way it's administered. Do you think we're past the worst, like COVID? I mean, when I think about COVID, everybody has some moments there, but are we past that? Is that still in the air? Is that still there underlining?
Hopefully we'll never go back to what it was in those early days, but it is still around.
It's still around?
It's still around. People think it isn't, and it's fabrication, it didn't exist, but unfortunately the patients that we're seeing in hospital are making it quite clear that it's still around and it's still affecting the vulnerable.
So it's so important that you reach out to the community to get vaccinating, because at this moment in time, there's a lot of pressure on the NHS. And if we don't get the vaccine out there, more pressure will be added to the NHS. So, how do they go about this? They come in, they walk in, they see you. What's the procedure?
Okay, hopefully they've already had the first alert from their GP that they should be going and having their vaccination of COVID. What the vaccination program is trying to do is go out into the community and give the vaccine so that, as in Croydon, it might be in the shopping centres, set up somewhere there. As you're walking by, you see the sign, just come on in and come and ask us whether you should have it or shouldn't. It'd be our pleasure to talk you through your concerns, your fears, and just, and then vaccinate you if that is appropriate.
But what's the fear? Because let's see if we can eliminate this. What is the fear of people taking the vaccination? What is the fear? And now we're making this campaign out there to people to say, come and get it. What are the fears? Why we're doing a program like this, telling people to take advantage of the vaccine?
The fear is people the myths around that if you have the vaccine, as in flu, you get flu.
Yes.
That is one of the big flu, or they think it's been tampered with by the government, and if you have it, something else will happen to you. There are a lot of people, just because of lack of knowledge, they become more fearful, and hopefully part of our aim is to educate and let make people aware of what's out there, how the vaccine works, what it's going to do for your body, and not just you, but others that you come in contact with as well.
That's important, yeah. Others that you come in contact with. I mean, from your standpoint, have you seen the benefits of someone taking the vaccine and when you see them the following year, whatever, you can see there's a change? What benefits could you promote to those contemplating or thinking about taking the vaccine? What are the benefits from your position?
So, the benefits that sometimes people think, oh, I've got the flu, and maybe they've had a heavy cold and they think it's the flu. If you have the flu, proper flu, you won't even be able to get out of bed. That is how serious it is. You are incapacitated.
Okay, let's bring that back. So when somebody has the flu, they're in a position where they're just incapacitated. They cannot come out of their bed. Everything, the whole world turns upside down.
Yeah.
This is what you're trying to say. Get the jab or get vaccinated to prevent that, putting even more pressure on the NHS.
Yes, even on your family, because somebody's going to have to look after you as well in that vulnerable position. But yes, and the trouble is, if you leave yourself vulnerable, you've got the risk of being hospitalized, you've got the risk of getting secondary infection, you've got the risk of complications arising from you having the flu. Somebody who has had really bad flu, the second year when they've had the vaccine, they've seen the difference. They were not ill.
That's the thing I wanted to hear from the success.
They're not, yes, it absolutely makes a difference, but you'd have had to see them when they had the flu to know a year later when they're vaccinated that they're sure that they're not going to be incapacitated the same way as the year before.
Okay, Christiana, let's cut to the chase. Can people die from this?
Absolutely. Flu kills. And that's what people need to understand. The flu is not like a cold. And sometimes people think of the flu, they say they've got flu when they've actually got a heavy cold.
Now that's interesting to hear, people can die from this. And, that's why I would never, ever knock the NHS. I think it may have its individual problems because of the pressure. But I want to thank God for it. Not a lot of church, not a lot of organizations or countries have this institution. So we're trying to ensure that you understand the importance of getting the vaccine. Now, can I talk about the age difference? We talk about the vulnerable. How about the young people and the children? What benefits can it add to them? And are they able to take it as well?
The age group for flu said is 65 plus is what we're aiming for.
So 65 plus.
Because they're more vulnerable, and those who are immunosuppressant, as in they've got underlying serious health issues, and so their body is more vulnerable to catching different viruses.
Could we just so those underlying issues, different? Give me an idea. Blood disorders.
Blood disorders, things like lupus, HIV,
right.
MS, sickle cell. Going through chemotherapy, treatment for cancer of one sort or another.
So if they get it,
yes,
in that position,
their body struggles to fight against it.
So having it is like prevention better than cure. Yes.
Yes, definitely.
That's an interesting point there. Talk about the children, their age gap. I mean, you talk about 65 plus. Do they have to pay for this?
No, 65 plus, you do not pay for having flu vaccine.
Yeah, there was some governments going around that they had to pay for that. I knew that wasn't the case.
It was those who are younger that are not in that category of being 65 plus or being seen as vulnerable because of their medical condition. Those two distinctive groups do not have to pay for it. But if you want it because it's not harmful, it's good for your benefit, and you're in between that, that group, you can go and get it from the chemist, or they will supply you, but you'll be at a charge because you're not considered vulnerable, but you just want to protect yourself.
Okay. Any side effects? from taking this? Because that may be some reasons why people don't want to take this, side effects. Do you know, is there any side effects from taking the vaccine?
The side effects that we say you'll have is it's an injection for the adults. Your arm is going to be sore because it's been pierced. Your skin has been pierced, so it's like a little cut. You will have sore arm for a couple of hours, even maybe up to 48 hours. There might be slight swelling around there because the injection makes your body react, against this vaccination as it's building up its protection. So you might have local inflammation, but again, that will go off. You may have the snuffles for a couple of days, which makes people think, oh, I've got the flu, but it's not. But all those kind of things, even if you take 2 paracetamol every 4 to 6 hours, they will, knock it on the head and it won't be. But those are your side effects. If you feel really ill and you think, oh, this is causing me to feel
nausea, dizzy.
Nausea, really body ache, I can't move, I can't do this, but you might get a slight temperature, but if it's ongoing, then you really should seek medical advice, as in take yourself to A&E if you can get a GP appointment that quickly, go and see someone just to have that second opinion that am I reacting to the flu or is something else happening.
Okay, you've covered the age grade, but let's go back down to the children. I mean, how must they feel? What are the age group? And we say the jab and people might, the piercing. Is there another way of administrating the vaccine?
For the younger age, at the moment there is a campaign going on for like from the 2s to around 4-ish, and they have what we call it flu jab, but it's not a jab, it's a nasal spray, which like one little spray in one in your right nostril, and then another little meal in your left nostril, and that's for the children. It's like a fine spray, sticky thing that they just have in there because they're children. We don't want to scare them with with all more needles and kind of thing. So
And what's the age rate? What's the age group for
from between 2 to 4?
Wow.
School, and they're offering it also to some school children as well if they want to have it as well. School age children.
So bottom line, you are, as you administrate this the vaccine, that you would say it's so important that we get vaccinated against flu.
It is, because it's on the increase already in the hospital with people being admitted with flu as well as COVID at the moment,
Good.
It's on the increase.
So it's something that we should be doing.
Yes, especially if you fit into those categories.
So I get up one morning and I said, where do I go to get this? How can I be signposted? Do I have to ring my GP to make an appointment? Is there anywhere local that I can just go and get it? And if I do turn up at that place, what are they going to be expecting from me for me to say, right, I tick all the boxes and now that vaccine can be administered to me? What's going to happen when they walk into the door? And where can they go? That's important. Where can they go?
They can go to their GP, and also they can go to their local chemist. Some of the, in Croydon, we're quite fortunate. Many chemists will do the vaccination, so you can go to them. Even some Superdrugs places where they've got a nurse, they will vaccinate you there, and Boots and that kind of thing.
Okay.
And also Croydon has community settings that sometimes we set up, like shops, if I can call it that, where we're there and people can pop in, like a hub, exactly, where people can just pop in, on their way shopping or wherever, and just go in, and we are there, and we'll be more than happy to give advice and information as well as the jab if you want it on that day.
Good. And if we focus on Croydon, I'm sure there's loads of hubs around the country, but I think the BEME Forum, they have a place in Croydon that will administer the vaccine. Is that correct?
Yes, we have, can I call them pop-up clinics within there that they have in there. It's not, there's no, at the moment, I say it's irregular. We used to be every Friday. I'm not sure if we're still, every Friday afternoon, like from 10 to 2. It's in those hubs, like if you're going to Wheat Gift, we're set up there and you can have it. There will be a clinic there.
Now, this kind of I mean, you're just giving us on the ground. Let's burst the myths, destroy the myths, why people don't think they should take and maybe just boil up what they know to boil up and drink. Those older days remedies. But there are a lot of myths around people not taking them. Could you name a few of those that you feel why people do not want to take the advantage of something like taking the vaccine from your perspective?
People feel when they take the flu vaccine, they will get flu. And
it's meant to prevent flu.
It's a preventative vaccination. It doesn't give you flu because what happens sometimes with people is they've already picked up the virus and then they come and they have the flu, but the virus hasn't shown its full course. And when they have the vaccine, they then feel it's the vaccine that's giving it to them, but they've already caught the virus
now, that's
already.
A very interesting point, because I've heard people think the flu, if I take the vaccine, it gives me the flu, but you're saying it was there already. Their
body was already incubating it. And then with the vaccine, they'll start to have symptoms, but it will never be the same as if they didn't have the vaccine, because that symptoms that they were feeling, it could have got a lot worse and they would have been hospitalized. But with having the vaccine right at that point, it actually knocks it on the head so that they may get some symptoms, but they won't be hospitalized as they may have done.
And that's what we're trying to prevent, isn't it?
Absolutely, the hospitalization.
People going into the hospital, putting more strain on the NHS to look after us, and long term we'll get the issue. I think you've heard it here directly from Christiana. She's trying to communicate to us to take full advantage. And look, ask questions. If you're not sure, ask questions. And I'm sure they're there to pilot us through. And I'm sure when you meet somebody as lovely as Christiana, she'll talk you through, ask you the relevant questions that would say, yes, I think you're eligible for this. And I guarantee you, by stepping up, taking the vaccine, it'll keep us more safe. Because I asked the question, do we die from flu? She said yes. And I'm not scaremongering, but we have to face the facts. If we can have something that will prevent us from being in a position of getting worse, and if there is something underlining that could blow up, we should take advantage of this. As you begin to think right now, wherever you are at this moment, it's a campaign that goes around every year, and I'm sure the numbers must be getting much more better as far as people taking up this advice. But yet still, there's always a different strain, isn't there?
Every year it mutates. The flu virus mutates every year. So we're always like trying to play catch up with it because we don't know what the next one is. But the one that is known now is the one the vaccine is made from. So that if your body comes in contact, even if there's been a mutation, it's still that same family of the virus, so that your body will still be able to build immunity against it.
Excellent. Well, Christiana, I'm going to do at this moment, I think I've learned a lot, and I'm sure our viewers have learned a lot, but I think if you look at that camera and just, as if it were, just speak to thousands out there at this moment that may be contemplating, what shall I do next? I'm the interviewer, but I've learned. But I'm going to ask Christiana to speak to you right this moment and encourage you to think about your next steps. You may be suffering or slivering as we talk now. There's still hope.
I would say to you, don't listen to the myths. Find out the facts for yourself. Visit the hubs, visit the chemist, visit your, try and speak with your GP. Find the facts out for yourself and not listen to all the tales, because sometimes they freak you out, and Dr. Google is not always right as well. So please bear that in mind. We can give you the facts, we can give you the figures, we can reassure you for any of those fears that might be going through your mind. We're here to help. It's not our aim to disable anyone, but it's more to give you life so that you can enjoy your life longer and not spend days and weeks in hospitals. As great as the NHS is, it's under pressure. And if we can relieve that pressure of being hospitalized and you staying healthy, I think you should choose healthy. It's better.
Well, I couldn't put it better myself. Thank you so much, Christiana, for coming in and sharing with us on this very important topic that comes around every year. And as we hear, there's a new strain. Choose life. And we're grateful that we have this type of medium that we can bring to you, because I think it's so important that we take this information and use it to our best advantage. Thank you so much for coming in.
Pleasure.
And I pray that everybody that's heard you today will make further investigation. We thank you for all that you do in the community.
It's our pleasure.
Thank you.
We're all in this together.
We are indeed.
Thank you.
Well, I hope you enjoyed the program. I hope you were educated as well. And who knows, we will bring another program to you that will be of relevance also. And we pray that these particular programs really speaks to your heart and speaks to the community. So thanks for watching. And remember, you're the head and not the tail.
Well, I hope you enjoyed that. But we're not finished yet. We've got another guest. I'm sure it's going to educate you. Watch this.
Welcome to our community engagement program. These programs are designed especially to bring information from the community directly to you. And we bring experts in, people who knows what's happening on the ground. Well, we're in that season again, aren't we? It's looking very much like Christmas, but with it comes the cold. And not just but also the sniffy nose, high temperature, the flu. And so this program is geared towards ensuring that you get vaccinated. And so I work very closely with the NHS, and I've got in the studio at this moment a very good friend who's been here many times before. I've got Bernard, the matron, who is connected to the NHS. And I thought, who else to bring in to talk to us, how we can take care of ourselves in this particular season. Thanks for coming in, Bernard.
Thank you for having me again. Brilliant.
I think it's so important that we do programs like this to educate our community. And I told you, I learned so much on the current years, and even to see how things are going. But bring us up to state. What is the current state at this moment with flu and COVID?
Where
are we now?
So where are we now? We're now in flu season.
Yes.
As you're aware, it's hitting us hard. Of course, it starts normally in September. That's when we start doing flu vaccinations. And it goes all the way until March next year. What we're finding at the moment is that flu is hitting hard. The flu virus that we are experiencing actually comes from Australia. Is the Australian strain, as they call it.
Wow.
So that's what we're finding, is that it hit Australia really hard and is now coming towards Europe. And of course, the UK is part of that. So it's coming our way. We're finding that it's hitting early compared to the previous years. And hospitals are starting to fill up. It's also hitting the vulnerable groups. Your vulnerable groups are your children, age group 2 upwards, so 2 until 18 we consider children. And of course, those are also the ones who can spread it, mainly, especially the young ones. And then, of course, your vulnerable adults, which are, of course, people aged 65 plus, and those who have underlying health conditions, but also those people that work with vulnerable groups like healthcare workers, like myself, also get vaccinated. And again, because we ask those people to get vaccinated is to make sure they don't spread the flu if they do have it to those vulnerable groups they will be working with. So where we are at the moment is it's getting critical. We've been asked to do a big week to push the uptake of flu, because the uptake has been very low, especially in Croydon, where the uptake, especially in the younger group, as we call it, especially the school age groups, for example, is very, very low. For an example, I went to a school last week where they do nasal flu. So it's called it's vaccination, but it's not. It's actually it's a nasal flu. So it looks like an injection, but it goes into the nose. It's just a little spray. It's quite a sticky substance. So it sticks to your nose, and your body makes antibodies to fight the flu
What's
virus.
the ages on that? So to interject
So school age is 4 upwards.
Oh, to get the nasal.
To get the nasal flu, you can 4 right up until when you're 18. And if you have a specialist school, because people have, let's say, learning disabilities, for example, you can go right up until 25 years old. So the nasal flu, the reason being that we use it for those groups is because it doesn't hurt, it's quick, it's literally a little spray. It feels like they tickle your nose, and that's how it gets inhaled. And it might have a bit of a drip, but what it does is it takes about 2 weeks for the virus fully to get antibodies within your body, and that's when you protect yourself, but also people around you.
So the question I have to ask, I mean, that's a lot of information. I mean, what have been the benefits that's come out of these campaigns in the vaccinations over the years? What's the benefits that now come forward?
The benefit is that the main one is that you don't fill the hospitals.
Yes.
The NHS is,
of course.
I always call it on their last legs. Although they do keep standing, we keep propping them up. But in the winter it's always more strain. It's always more difficult. So that's why we try to make sure during vaccinations we try and alleviate the pressure, but also the pressure on families themselves, because if somebody is ill, you will have to take care of them or take them to hospital with all the extra expenditure which that will bring with it, having to go to the hospital, but also being in hospital is not great.
It's not the option, is it?
No, it's not the option.
It's not the option. I mean, you see, we don't look at that, you know, I don't know what that campaign was, catch it, bin it, throw it, or whatever.
Yep.
You know, I can't remember it now. But see, we don't think about it. Once I've got it, we are prone to send it to somebody else.
Absolutely.
And the chain reaction begins to develop. That's why I love this particular campaign. We're telling people to get vaccinated against this, because I think it's so important. I mean, tell us about, let's emphasize on the importance of the flu and COVID vaccination. Mm-hmm. How important, just stress this, how important is it for us to step up and get these vaccinations?
It's mainly important for those who have underlying health conditions. So those who are ill, those who are vulnerable, really need to protect themselves.
Could you break that down a bit? When you talk about ill, vulnerable, what underlying issues are we
vulnerable
addressing?
So, for example, if you are, we say immunosuppressed, which means your body can't, you've had cancer treatment, for example. Therefore, your body has lost all its immunity. Therefore, you need to protect yourself, either with COVID or with flu vaccinations or other vaccinations. But mainly in this type of year, you need that. Other underlying health conditions could be if you have diabetes, if you have high blood pressure, for example. Anything that if you're older, your body takes longer to make antibodies. It also takes longer to recover from if you're ill. So if you do get the flu, it's not like just a cold. You won't be able to get out of bed. You won't be able to make yourself a cup of tea, for example. You'll be a burden on the people around you because they will have to assist you. But also, if it takes longer to recover, you may have to go into hospital. And in hospital, of course, then it will take again longer to recover. And then ultimately, if you don't treat it properly, it could also lead to death. So that's something.
That's right. Let's not sugarcoat this. It's important. People can die from flu. This is the risk.
Yeah. Especially if you have underlying health conditions, being vulnerable, as in, having diabetes, HIV, or other underlying health conditions. It is very, very important to get yourself protected. Okay,
can we talk about the vulnerable people? I want to just talk about that again because we just don't know how we're passing this on. It's the risk of death, and I did say you can die from flu.
Yeah. So how you basically, it's a bit similar to everybody remembers COVID. where the awful times. Although, funnily enough, it's not that long ago, because it's only 5 years ago that we were all in a situation. If you remember the queues with people having masks on, having to wash their hands continuously, you couldn't touch each other. So what you need to remember, especially going into the flu season or going to with Christmas, wash your hands. Once you wash your hands, if you wash your hands for 20 seconds or more with soap, once you've been to the toilet, for example, or you've sneezed in your hands, again, make sure you wash your hands, because that's how you pass it on. It's by touch. So if you touch the doorknob, for example, or you touch the teacup you give to somebody and you've not washed your hands properly, and you are, for example, you might have the virus, but you don't know yet, but you can still transmit it. That's how you catch it. You catch it when then you touch your nose, and then it goes into your system. If you sneeze, for example, make sure you cover your mouth.
I mean, it's just so, it's not rocket science, is it? But it's something that we would just do naturally without even thinking. And this is why I love programs like this, because it highlights the things that we do without even thinking, but could cause a big stumbling block in somebody else's life.
Absolutely. Absolutely.
And that's why you're on the program, to tell us about this is the season where people are going to be vulnerable and we need to know how to deal with it. I mean, here in the program, how do we access the vaccination service?
So how you basically, so if you are, as they say, call it in cohort, or you are in the group that is able to have the vaccination, as I mentioned, if you are, we can start with the children. If you're 2 to 3 year old, you can go to your GP, you can go to your chemist. Your parents can take, the parent takes the child there, explains to the nurse that they're coming there for flu. You do not have to pay for it. And it's a nasal flu. What you do need to remember with nasal flu, if the child has any egg allergies, then they can't have the vaccination. If the child, for religious reasons, cannot have or eats pork, we advise you not to use the nasal flu, because there is a protein, or it's called porcine, which is used. It's a gelatin, which is within the vaccine, and therefore you shouldn't have it. That will be explained to you by the clinician or the nurse, so they'll ask you that question. But that's the reason I mention it. So what would be the case in such a case would be that the child would need a vaccination, which is a cell-based vaccination, which a child can have from 2 years upwards, which is a little bit more invasive, but again, you protect your child for the flu in that sense.
Right, so again, I step into a hub. These are the questions that will be given to me first before it's administered.
Absolutely.
So it's not like walk-in, bang.
No, absolutely not.
There's a consultation.
Absolutely. We'll always do a consultation. The reason we needed to do a consultation, for example, we need to know if you have any underlying health conditions, because we can't give you the vaccination, for example, if you have egg allergy, for example, with a child. Suddenly we'll have an anaphylaxis reaction, because your body will suddenly have a reaction. We can't have that, so that's the reason we ask you all the questions beforehand before we do anything. But that's the way it should be with any medication you receive.
Have a consultation first.
Always a consultation. Otherwise, you shouldn't have it. If you feel, if you go somewhere and there is the consultation is not to your standard, or you feel they didn't ask me all the questions, you can also refuse. So it's not something you can just say, oh, the clinician said I had to do this. No, you can also ask the question. So I think that's something you also need to remember. It's your body, it's your choice, but you also need to be informed properly. So,
got it. Great information. You're the stats man. Tell me, why don't you just tell us some stats out there that will be interesting to know concerning the area of the vaccine? Tell us some facts.
So Croydon, for example, it's if we take the flu vaccination, the eligible groups in Croydon, of course, I've already mentioned, are all the groups. We are at 40% at the moment of flu uptake within the borough.
The whole borough of Croydon?
The whole borough of Croydon.
40% uptake. That's not bad.
That's not bad at all.
It's not bad, but I'm not saying that's good. We want 100%, right? So
You
that's
do.
interesting. So you're the stats man. I mean, this is interesting.
Yeah. So we're up to 40%, but we want to be higher than 40%. We are, compared to other. But one thing I do need to mention is that in the primary schools we are currently at 32%, and secondary schools only at 22%.
What was it previous year?
It's going down.
Going down.
It's going down. So the uptake of flu within schools is very, very low.
Wow.
So you need to think of it this way. You have an eligibility group of about 750,000 people. Only 300 people have taken up the flu. 300,000 have only taken up the flu. So that's not even half.
No.
So if you look at schools, I went to one school in Croydon last week, and if you think about it this way, the school was about 550 children. We only vaccinated 200.
I've got to stop there because, I mean, this is interesting. That's why we need to bring in the facts and the stats. Why do you think this is? Is it shrouded with myths? What do you think is it? I mean, is the school helping? Is the school helping to promote this? I mean, you're going in there, so they must be working in partnership with the NHS.
Absolutely. No, they are working with the school immunization teams in Croydon. And one of the things they're finding is, I think there's two things to it. One is, they've gone away from a paper. Back in the day, your child would come home with a letter saying, "Oh, we need the flu vaccination." We've now gone digital, and it could be that it's possibly something to do with that they get a text message, and we get quite a few text messages from the NHS, for example. You think, "Oh, I'm not going to look at it." So that could be something that some parents or people don't have time.
Wow.
Some parents may not read English as well, because that could be a reason.
Yes. They're not up to date with digital age as well.
Some phones may not take take exactly digital age, and also then the consent form is digital. So if you don't read English as well, or you suddenly see something you have to fill in, again, you switch off.
Wow.
So that's why some parents may not be the case. Some parents don't want their child to have the flu vaccination for whatever reason. That could be either religious reasons, or that could be dietary reasons. So those are some of the reasons why.
So there's a lot of things, isn't there? Although you're offering this brilliant service, prevention better than cure, there's still some barriers that prevents this great thing of vaccination reaching every single person. And I'm glad you're saying the schools are opening the doors for you to come in and educate, but yet still the take-up is still very small.
The uptake is very small. I mean, our team has now been asked to come and look at some of the schools where we come in the mornings and to assist them with speaking to parents if they have any queries or questions. But again, that is a very small group that we do speak to. So we do try and assist parents, but what we also do is, if you have any clinical questions, there is on the schools, they tend to have it's a call center. They have a clinician there you can speak to. If you have any queries or any questions, you can just ask them, and they can explain anything you may have.
Right. This is the crunch time. Now, we do these programs because we find them to be essential. We're communicating something of health and well-being, and that's why we bring wonderful people like Bernard in here, who understands it, sees it firsthand, and maybe sees some things that we wouldn't want to see. But as I said, prevention is better than cure. I want you to take this time at this moment to speak into that camera, and somebody could be contemplating or thinking about, should I not, whatever, I've heard myths about that. But at this moment, you are speaking to someone who's lived it, walked through this, know the stats, and want to see us get better and coming into schools, being available. I want Bernard to speak to you, to emphasize the importance, why this vaccine is so important.
The flu vaccine comes around every year, and every year we say, we've had a very tough flu season last year, and every year it seems even tougher. Partially because because the flu vaccine the virus changes continuously. So it's very tricky to know exactly which virus is going to come our way. Trying to make the vaccine exactly hit the one you want is very tricky. So the important thing is, if you have the flu virus, it may not be the same virus that is coming in the winter, but because you already have it, your body's making antibodies and will be able to fight any flu virus coming in because they tend to be quite similar. Think of the people around you when considering taking the flu. It's not just for you, it's protecting all the people around you. So if you have young children, for example, and they're going to see their grandparents over Christmas, and you have them vaccinated as well as yourself, or possibly, but they're protecting your grandparents who might be of ill health, or their immunity is not as strong as it may have been back in the day. So it's important to think about other people around you. So that's the reason I urge you to come and talk to us. You may have your doubts about it, but that's what we're here for. We're here to explain it to you. We're here to put your mind at rest, at ease as well. And then we can either you go ahead and say, do you know what, I'm going to go away and I'll come back another time. I just need to think about it. Or you say, yes, I'm happy to have it, and you can go and have it. Again, we're not here to push, but we're here to advise and to help to make you the informed decision. And that's for yourself, but also for the people around you.
Well, I couldn't put it better myself. We are very fortunate in this country. I think the NHS is over, 75 years old or more?
Yep.
And we can see the strain that it's going through. And if we could prevent more strain by taking up these wonderful offers of getting the flu jab, being vaccinated against something that could eventually, if not taken serious, kill us. And we're in a country where it's offered to us free.
Absolutely. So if you're the eligible group, then you are. It's free. So if you go to a pharmacy and they say no, you need to pay, you can tell them no, I'm not. I'm in the risk group. Or if you have children, for example, the school immunization team. Normally, if your child has missed the flu vaccination day that the immunization team was at the school, they normally send out another email to the school, who then will advise you where they can go and get the vaccinations. Normally, it's in a weekend. What we've also been seeing is that a lot of parents tend to go with them, and actually the uptake in that group has been very good because parents want to. So we're seeing a shift from parents going with their children to get the vaccination. Again, it's not a vaccination, it's a vaccination in the nose. It's a little nose spray, painless, and very, and as I mentioned, it takes about 2 weeks for the body to make immunity and to protect your child as well as people around them.
Now, here's my closing. You have been educated. I always say, if you think education is expensive, wait for the bill for ignorance. I repeat it again. If you think education is expensive, wait for the bill for ignorance. I would say that we're so blessed to have our matron here, Bernard, talking to us about the importance of being vaccinated against the flu. He's educated us. We don't want to be ignorant. And we are in a position that you can ask questions. You'll meet people just like him who will take the time, walk you through to ensure that you can feel at rest and safe. Bernard, I want to thank you. It is a very serious topic. Every year, it's always a joy for you to come and to talk to us, to educate us, and that we change our thinking.
Yes. Well, thank you for having me. And
I'm very grateful. Very grateful. And I hope that you've learned on this program about something that could prevent you from being seriously ill. Because as we've just heard, flu kills people. I don't think that should be any one of our portions, especially when we have this information available. Bernard, thank you for coming in and sharing as you do every year. It's always a great joy to see you, and we pray, and as I say, I'm always grateful for what you do. Thank you so much.
Thank you.
Well, I hope you enjoyed this program. I hope you've learned, and I hope you take this information on. All I'm left to say is, remember, you are the head and not the tail.
Can I remind you, if you think education is expensive, wait for the bill for ignorance.